Hello friends, I am presenting a case of polypectomy. Here, by transvaginal ultrasound, we can see an hypoechoic mass arising from the anterior wall of the uterus and bulging into the endometrial cavity, which is nearly 3 into 2 centimeter in size. Hysteroscopic polypectomy for this large size polyp can be troublesome for the worry of volume overload. So care should be taken to finish the procedure as quickly as possible, as once we go through the resection of the polyp, more and more blood vessels inside the polyp will open up and will start absorbing the fluid. So we should be very careful, should to try to finish the procedure as quickly as possible. Here we are seeing that polyp is arising from a anterior wall of the uterus. Right tubal ostia is seen clearly. And first we have to make a dry attempts to get the proper depth perception so that we do not injure the wall of the uterus, that is endometrium is not injured. So we should make a one or two dry attempts. You can see the stalk that is arising from the anterior wall. Now we'll go to the complete extent of the polyp, make one or two dry attempts, then start resecting the polyp. But it should be resected systematically from one side to the other side, and it should be resected towards the resectoscope. We should not activate and push the resectoscope for the fear of perforation of the uterus. Here we can see as we resect through the polyp, some of the blood vessels are seen. So we can see that some of the blood vessels are opening up. So we have kept the fluid pressure nearly 110 millimeter of water. So as we resect through the polyp, we can see that more and more blood vessels are opening up. So these opened blood vessels will try to absorb the fluid. Since we are using the normal saline as a distending media, the allowable deficit can be up to 1 to 1.5 liter. But every time make an attempt to finish as quickly as possible. So this hysteroscopic procedure should be finished in less than 10 minutes. So this is a unedited video of resecting the polyp from the beginning. So we can see since it is an anterior wall polyp, so it is an advantage that whatever the resected bits are there are falling onto the posterior wall by gravity, and we can easily keep on doing the resection of the remaining part of the polyp. So here anterior wall polyp was an advantage as an ergonomic point of view, and every time we should try to resect it towards the resectoscope, should not push away. So now try to finding the uh, stalk and try to push it and make that it is taut and it is allowing for the resection. We try to just push it with a cold knife without the activation of the loop, and then try to resect it. Should be done, resection should be done slowly and systematically, and every time we can see nearly 5 millimeter of polyp is being resected. This is the 29 French resectoscope, that is a conventional method. It is not a mini resectoscope. So the advantage is that bigger chunks, but the disadvantage is that it needs to be dilated nearly 8 millimeter, or number 8 or 8.5 Hegar dilator need to be used for the dilatation of the cervix. Only then we can use this conventional resectoscope. But the procedure goes very fast as compared to a mini resectoscope. So we can see that the final part of the stalk is being cut with a reverse cutting. It should be very careful whenever you make an attempt for reverse cutting of the tissue, when it is not possible to take out in a pulling towards the resectoscope. Only then, only the final part, and it should be very careful that it should be under your control, so that we do not go beyond the stalk. Only the stalk part is divided, and the loop, activated loop, does not go inside the myometrium, so that we do not perforate the uterus. So we can see nearly the final part of the polyp stalk is being resected. Now we try to remove all the bits, and we'll have a one more look in the end, so that we make sure that the stalk is resected completely, so that recurrence of the polyp does not happen. So this is the second look after removing all the bits of the polypectomy that was done. So the tissue that is stuck to the loop is being detached. So now that is a final view after removing the complete nearly 3 into 2 centimeters. That's a very big polyp to attempt in the hysteroscopic method. So more than 2 centimeter will be bigger polyp to do under the hysteroscopic method. So care should be taken that we finish the procedure as quickly as possible to reduce the chances of volume overload. Since you are using a normal saline as a distension media, so there is an advantage that the distance deficit can go up to 1 to 1.5 liter. So that is the final bit of the stalk is being resected. So this finishes the procedure of polypectomy for this patient. Thanks for watching this video.